From theories beyond the grave to supernatural occurrences, many are skeptical. But what if we have all been lied to? What if life has a deeper and more sinister meaning than what the eye can see? Enter the deepest parts of planet Earth, where we introduce theories, ideas, and opinions that aren't so far-fetched as one may believe. This is Theories of Cosmic Matter. From TV shows like Vampire Diaries to books like Twilight to games and even folklore, humans have always been fascinated with these creatures. However, is it possible that they are real? Has there been any sightings of these so-called vampires? Even though it's doubtful, let's dive into this idea. There is a blood disorder called porphyria. The symptoms include extreme sunlight sensitivity leads to facial disfigurement, blackened skin, and hair growth. In addition to facial disfigurement, repeated attacks of the disease cause the gums to recede, exposing the teeth, which then look like fangs. The urine of people with porphyria is dark red. Folklore surmised that they were drinking blood. Some physicians had recommended that these patients drink blood to compensate for the defect in their red blood cells, but this recommendation was for animal blood. It is more likely that these patients, who only went out after dark, were judged to be looking for blood, and their fangs led to folk tales about vampires. So in reality, the idea that vampires drink blood was just misinformed people who started the rumor, and it's stuck to this day. The sulfur content of garlic could lead to an attack of porphyria, leading to very acute pain, thus the aversion to garlic. In mythology, a vampire is not able to look in a mirror or cannot see its reflection. The facial disfigurement caused by porphyria becomes worse with time. Poor oxygenation leads to the destruction of facial tissues and the collapse of the facial structure. Patients understandably avoided mirrors. During the Spanish Inquisition, 1478 to 1834, 600 vampires were reportedly burned at the stake. Some of these accused vampires were innocent sufferers of porphyria. Porphyria patients had good reason to fear the Christian faith and Christian symbols. Today there have been cures and such for porphyria, which can lead one to believe we have found a cure to vampirism, but it's all due to folks who believed in irrational thinking, who spread rumors of people who wanted to create something that wasn't real. Regardless, the term vampire came about due to this blood disorder. Substances called porphyrins build up in the body, causing a variety of symptoms. Porphyrins are molecules that undergo a series of reactions catalyzed by enzymes to create heme, a key component of hemoglobin. Hemoglobin is found in red blood cells, and its main function is to carry oxygen around the body. Disturbances in the heme production pathway mean that heme cannot be produced despite the presence of porphyrin. This causes porphyrins and precursors to build up in tissues and organs and leads to a heme deficiency. The disease occurs when the porphyrins affect the nervous system or are activated by light. There are two types of porphyria, which are acute and cutaneous. The acute porphyria has a sudden onset and mainly affects the nervous system, although there may be some skin involvement. In all cases, porphyrins build up in the liver. The cutaneous porphyrias mainly involve the skin, and porphyrins typically build up in the liver or bone marrow. The symptoms between the two types of porphyria vary. The symptoms of acute porphyria appear quickly and can be severe. They can last days to weeks and vary in severity and duration, which can include red or brown urine, abdominal, chest, and back pain, nausea and vomiting, constipation, diarrhea, anxiety, confusion, hallucinations, paranoia, disorientation, urinary retention or incontinence, muscle weakness, paralysis, seizures, breathing problems, palpitations, high blood pressure. The symptoms of cutaneous porphyria are chronic, meaning they last a long time. They also vary in severity and duration, which can include red or brown urine, sensitivity to sunlight, pain, burning and stinging, redness, swelling and itching, blisters on exposed skin, not seen in erythropoietic protoporphyria and X-linked protoporphyria, fragile skin, infected blisters, scarring, changes in skin color, excessive hair growth in affected areas. Most porphyrias are genetic disorders and are known to be a hereditary disease. Inheriting a gene variant for porphyria does not automatically lead to the disease. Other factors may be required before symptoms develop. These include taking certain medication, environmental factors, sunlight, chemicals, or lifestyle changes, diet, alcohol or drug use, stress, and some carriers of a gene variant will never develop porphyria. Modifying genes also play a role in the development and severity of erythropoietic and hepatic porphyrias. In particular, a variant in the CLPX or CLPP genes increases the severity of erythropoietic porphyria. It's safe to say that the ideas of these so-called vampires can be debunked, and it's all just a blood disorder. But who is to say that vampires don't exist? Who is to say your neighbor, friends, or family members aren't vampires? This is Theories of Cosmic Matter. Thanks for watching.